Okay, I'm gonna be measuring a blood glucose today. So the first thing that I would do is review physician's orders, and then I would identify patient. So I'd have the patient state their name and date of birth. Then I would wash my hands, and then I would don clean gloves. While I'm donning my clean gloves, I would tell the patient to wash their hands and to dry their hands thoroughly. After that, I would go ahead and turn on my blood glucose machine and then insert the strip. Now I would select the finger that I would like to use or the finger that the patient prefers, and it has to be the most lateral distal end of the finger, so about right there. Once I found my site, go ahead and grab my alcohol prep pad and clean the site. Allow it to dry, and with my lancet, I'll go ahead and pierce with my cotton ball the first drop of blood, wipe that away, and then I would lightly squeeze till some blood comes out and allow it to just drip onto the strip. And now the machine is reading, and now the machine shows that the patient has a blood glucose reading of 252. After I've done that, I would grab alcohol prep pad or an antiseptic wipe, and I would clean my glucose monitoring machine, remove the strip, I would place it into the sharps container and turn it off as well. Remove my gloves, and then I would wash my hands. And then I would explain to the patient's blood glucose reading, which was a reading of 252. Now I'm gonna be administering insulin. So the first thing that I would do is just check my patient's orders against the MAR. So this patient has an insulin administration order of regular insulin 6 units and MPH 16 units. So I'm going to wash my hands. I'm gonna don clean gloves. And I would identify the patient. So I'd have the patient state their name and date of birth. And then I would go ahead and do a focus assessment on the patient regarding blood glucose, as far as when the last patient's blood glucose was, what their reading was, their tolerance to eating, when's the last time they ate, when's their last insulin injection, and then what site it was given. On this patient, we're gonna say that their insulin was given on the left lower abdomen last time, so we're gonna do it on the right lower abdomen. And then I would just assess for any signs of hyper or hypoglycemia, such as polyuria, polydipsia, polyphagia, cold, clammy skin, and then, assess the skin for any type of redness or swelling or anything like that. So I would go ahead and, once I have my 2 insulins pulled from the MAR, I'm gonna check them again against the order. I'm going to check the expiration date, making sure that they haven't expired. And then I would roll each vial. Okay, now that I have my insulin syringe, my order says regular insulin 6 units and MPH 16 units. So I'm going to do cloudy to clear. So I'm going to pull up 16 units of air into the syringe. And I wiped the top of my vial. Going to insert and push in that 16 units of air. Remove the syringe, wipe the regular insulin. That one's regular. I would pull up 6 units of air and inject that into the vial, and then I would go ahead and pull up 6 units of regular insulin, making sure I don't have any air bubbles. Okay. 6 units of regular insulin. Then I would go ahead and insert it back into the cloudy insulin, and then I would pull up 16 units of cloudy insulin, making sure there's no air bubbles again. And so the total amount you should have is 22 units, and I have that here. Go ahead and recap the needle. And so if you drew this up outside of the patient's room, you want to go ahead and initial it, you know, name and date of birth on it, and then go ahead and check this with another nurse. So I enter the room again, and then I will do a check for the third time against the MAR. And then I'll explain the procedure to the patient, basically saying that I'm getting ready to administer 22 units of insulin. And so after I explained everything to the patient, go ahead and grab an alcohol prep pad and clean the site. Now if the patient, if you're able to pull up 1 inch of the skin, you can insert it at a 45-degree angle. 2 inches of the skin, insert it at a 90-degree angle. I'm gonna go ahead and insert it at a 90-degree angle because I'm able to pull up 2 inches of their skin. So I'm gonna go ahead and insert this insulin. Again, I'm inserting it into the right lower abdomen. Once I've inserted it, I can go ahead and place that to the sharps container. Do not recap the needle. Grab a cotton ball or alcohol prep pad and place on the injection site. Remove my gloves. Wash my hands, and then I would just document how the patient tolerated it, any adverse reactions, how the skin looked, where I gave the insulin, which was the right lower abdomen, how many units, which was 22 units, 6 units of regular, 16 units of cloudy and pH.